You're welcome to Safety Time Out with Madam Safety, and in this video I'll be giving us the 3 categories of persons that have been discouraged from the use of the nose mask. The 3 categories of persons that have been discouraged from the use of nose masks. And before I go into that, I want to establish a few things. One, I want us to realize that the fact that you have a nose mask does not override the other preventive measures. The fact that you are on a nose mask or you have the nose mask on does not override the other preventive measures. Physical distancing and frequent and regular hand washing are still your best bets when it comes to the prevention of COVID-19. Yes, as well as staying at home, staying back at home if you don't have anything important to do outside. So the fact that you have the nose mask does not override the other preventive measures. So I don't want us to be going around and because you have a nose mask you become lousy, you become nonchalant when it has to do with preventing COVID-19. So physical distancing and regular hand washing still remains your best bet when it comes to preventing COVID-19. Now, another point I want us to realize is your nose masks, the normal nose masks or your clothes, the normal nose masks or your clothes or fabric nose masks may not be surgical, but it still protects you. It still prevents the droplets coming in from someone that has already been infected and may not even know about it. So you must ensure that whenever you are in a public place, you have it on. Whenever you are in a public place, whenever you are in a place with persons that are not immediate family, make sure that you have it on. That's point number 2. And at point number 3, I want us to realize that it takes us to maintain them. If you have them, you don't maintain them, you don't keep them clean, you're still exposing yourself to all other stuff other than COVID-19 because you have to use this all day. So you ensure that you properly wash them, ensure that you sun dry if possible, and then you iron them, and you must wash them on a daily basis. You must ensure that if you have the clothes or the fabric nose masks, you wash them on a daily basis. And then these ones, if you have them, you discard them daily. You just don't use them beyond the day because you don't know where you have been to, and if you have come in contact with someone that's already been infected and you were lousy when it has to do with physical distancing. So you discard them on a daily basis. And if you are using the clothes or the fabric nose masks, always ensure that you wash them on a daily basis, sun dry if possible, and then you iron. And then always ensure that if you want to purchase if you have to purchase, but these are things that you can make your clothes or fabric nose masks at home. But if you have to purchase, or even when you have to make them at home, make sure they are made up of 2 materials. Make sure they are made up with 2 fabrics, and then if possible cotton in nature. Make sure they are made up of 2 fabrics, and then make sure that it is made with cotton if possible. Now back to the 3 categories of persons that have been advised by the Center of Disease Control after they have done their studies, they have done their investigations, they have come up with the 3 categories of persons that have been discouraged from the use of the nose mask. Now, category 1, children under 2 years. I don't want us to be overzealous when it comes to this prevention of the COVID-19. Please ensure that if you have children under 2 years, if you can keep them at home, that's your best bet. But if you have to take them out, ensure that you observe strictly physical distancing. Observe strictly physical distancing. Please don't use nose masks on children below 2 years. I repeat, please don't use nose masks on children below 2 years. And then category 2, persons that cannot take off the nose mask without assistance. Persons that you have to use it on them, and then they cannot take it out without assistance. It has been discouraged that because if there's any eventuality, they can't take it out. If they are suffocating or they have an issue, they can't take it out. So but category 2, persons that cannot take out the mask without assistance. And then category 3, persons that already have trouble with breathing, or persons that have respiratory troubles. So if you have persons that already have trouble with breathing or respiratory troubles, there are persons that once you just put on the nose mask, It's as if you want to suffocate. It's as if you're losing it. It's as if you're losing breath. It's as if life is going out of you. It has been advised that you ensure strictly that you observe the other preventive measures. Like I said, these 3 categories were brought up by the Center for Disease Control after they have done series of investigations and studies. And I want us to please stay tuned. I'm going to be taking us through a couple of guidelines for school resumption. Ever since I learned that schools will be resuming really soon, I have been so concerned, not just because I have my own kids, I have my own children, but because I have so many other children I'm so concerned about, so many other children that are a part of my world that I wouldn't want anything to happen to them. So I'm going to be taking us through my next set of videos. I'm going to be taking us through guidelines for resumption for schools, school administrators, and for parents especially, because I'm sure as much as I am concerned, there are so many other parents that are also concerned. Thank you so much for listening, and watch out. Like I said, stay tuned for my next set of videos. You can't afford to miss them. Thank you, and God bless you.